All right, welcome back to the Modern Nurse Podcast, season 3. I can't believe we're here. This season is all about plant medicine. Oh, plant medicine, cannabis, mushrooms, and I have the cannabis nurse Sammie here, over here, just chilling with me today, and we're going to educate the heck out of you from our own personal experiences and what we've seen out in the community of the use of cannabis for all sorts of things. So, Sammie, welcome to the club, and tell us a little bit about yourself.
I am so honored to be in this space, sharing space with you right now. Thank you, thank you. Like you said, I'm cannabis nurse Sammie, but I've been a registered nurse for about, oh my gosh, a little over 20 years. Healthcare is literally the only thing I've ever done since I was 16 years old. I'm getting ready to turn 50, girl. But I'll tell you right out the gate how cannabis kind of came into my world. I want to be completely transparent with you. It definitely was not anything new to me. Recreational, it's not new to me, but medical cannabis came into my world after being diagnosed with PTSD from COVID. Of course, I think everybody can relate to that hell that we went through. But I was a critical care nurse, a travel nurse. I've been a travel nurse for many, many years, all over the country, way before COVID. I walked away from COVID with PTSD, survivor's guilt, insomnia, anxiety, the nightmares, all of the things. And I was given 5 pharmaceuticals, and I did not want them. I was already completely numb. I couldn't even cry. I was already numb. So I really had just kind of an awakening of let's try something different, because these pills, I've literally given these pills to all of these people, all of my career. Let's try something different. So I dove into getting my med card. I'm in a legal state. I'm in the state of Missouri, and medical was legal at the time. So I kind of dove into that route. Got my med card because I wanted to do everything the right way. And there's no education. There was zero education, zero help. Bud tenders, love them, but not medical, not medical. They're not medically inclined. They can only help so much. Even the doctor that I got my script from, zero guidance. It was here's your med card and go find your way. So I just drove headfirst. As a nurse, we're educators. I want to know how this medicine's working in my body. I can tell it's working. But now I want to know. Turns out we have this huge endocannabinoid system that nobody taught us in nursing school, and it simply wants us to have balance in our lives. So the more I dove down that hole, and the more I learned about myself, the more I started healing myself, the more I started working on myself, there was no way that I cannot spread everything I know. It would be a complete disservice to my healing, my patient's healing, and the plant itself. So I started a business called Nursing Nature's Way that is fully just educational cannabis. Who can I get in front of to talk about this plant? And that's where we're at today. So, yeah,
My
that's
God.
it in a nutshell.
Yeah, that's amazing. It's so rich in information because it probably hits a lot of the nurses that are listening right now. You've
Yeah.
probably hit that pinnacle point of like, I am so fucking burnt out and I
Yes.
don't know what to do, but you still maybe want to be a nurse, but you're
Yeah.
like, how do I still be a nurse? And,
I'm a-
it's, yes, hospitals do drug tests. Yes, whatever. But like you said, we have an endocannabinoid system.
Yeah,
So it's
exactly.
not just
Right.
you're not just like hitting the Kemi
Right.
Jones 32% and getting high
Right.
up. There's
Right.
different components. So tell us a little bit about like the range of different endocannabinoids
Uh-huh.
that people can take. Let's start with a very common diagnosis in nursing,
Yeah.
anxiety.
Anxiety, number one.
Number one.
Honestly, just like a really quick little tip. I had jumped online and did a survey online, and it was specifically for nurses, for COVID nurses. And I had, immediately 200 nurses, bam, did my survey. 87% said they were newly diagnosed with anxiety after COVID. So it's out there. We know it's out there, but the endocannabinoid system literally wants to help you find balance. If you are way up here with anxiety, it wants to bring you right back down here. If you're depressed, it wants to bring you right back down here. So the crazy thing is that there's all of these cannabinoids that in the plant that you were just talking about. THC, that's the one that, gets you high. That's the illegal one. But there's so many other cannabinoids that can help with the anxiety. And the big one, of course, is CBD, CBG. You guys, if you are not using daily CBG, what are you doing with your life? It is legal. It is for the fight or flight. It is what us nurses need on the daily. So there's so many different cannabinoids outside of THC that we can be using that will not pop up on a drug screen that we can be using to help support our endocannabinoid system and help keep us balanced. So, and that's just all a part of the education. Whenever I first started, I didn't know anything about fucking CBG and all of those different cannabinoids, but that's all a part of the education and learning about the plant. So,
Yeah, absolutely. Yeah, it's so interesting because, we're taught in nursing school like stay away from the devil's lettuce and
yeah,
but it's really what they're just so just conservative in the effort
yeah,
of not explaining it,
yeah,
and
exactly.
it's
I
crazy.
feel like that's where kind of like the oh, what's the word? Like that's where the misinformation and there's no education.
Yeah.
I feel like once I start talking about it and make people kind of have that awakening, like I had, that,
Yeah.
hey, well, there's this whole holistic thing we could be using instead of going to the doctor and getting a pill and then getting another pill for the side effect of that pill you just got. And all of a sudden we're on 10 pharmaceuticals when really, you know, we have this plant that can really help us and it's individualized, and it really teaches us about our body and how to learn to listen to our bodies again. That's one thing that I loved in this whole process of my healing. And let me just preface this and say healing is a daily journey. Just because I'm like however many years into this, listen, I still have those moments like at work. I'm still working at a hospital. I work at a level 1 trauma center in pre op. And when I have to put a fucking mask on, I have flashbacks. And I know I'm not the only one that's listening that has that issue. So the CBG really helps with that fight or flight. I know I can put the gloves on. I know I'm not going to go back in my head to those shitty days. And it really just kind of helps me listen to my body and talk myself out and down out of those moments. So like I said, it's not that I'm fully healed and all of that. It's a process, but I know I can handle it now. So that's kind of what cannabis does for me.
Yeah, yeah, no,
Yeah.
I think that's great because, nurses and just humans in general, you guys need to understand this because what we're taught in, traditional nursing, traditional medicine, including our lovely prescribers, doctors, even nurse practitioners, they don't
Mm-hmm.
get the education on this.
Right.
So when a patient, which actually, I think I looked at it was like 84% of patients actually want information about
Yeah.
complementary alternative medicine, but
Yep.
their doctors don't have the knowledge base,
Yeah.
to
Exactly.
provide the information. And they're kind of like, no, that's bad. You can't take that. And it's like,
Right.
wait,
Actually,
hold on, let me go ask my neighbor about that because I see money coming from their house, right?
right.
Like they seem that they're always kind of pretty
Right.
happy, but um,
That's
I
so
think
true.
it's so important being, I left Emory University
Nope.
because of this exact problem. We're not teaching our nursing students the correct information. They're
Exactly.
teaching a one-sided blueprint, which
Yeah.
favors big pharma.
No,
Um,
absolutely. Absolutely.
and it's horrendous. And if you do speak up in those kind of settings, even if you do have a doctorate, they are like, no, you are in the wrong. This is not
Yeah,
your place. You have no experience. And as I
absolutely.
told you before, I'm
Oh,
like,
it's
off of eight
frustrating.
meds with
Yeah.
cannabis.
Yeah, but they're going to give you one more medicine to add to your
Yeah.
repertoire.
Yeah. Yeah. And they're
Yeah,
like,
it's
we don't like
crazy.
talking about psychedelics because we're like,
All
there's no
right.
scientific research. I'm like, no, but there's thousands of years of human
Actually,
research.
exactly. That's my thing. Is like, hello, this plant literally just didn't get made in Missouri last week. It's been around centuries. Like the history is there for centuries in every continent. It's everywhere. Why
Yeah.
are we not using it? I mean, I know why, but
We,
they
we
don't.
know. We know why.
It's funny,
Yeah.
like you said a minute ago about just talking with doctors. When I do one-on-one patient care, whenever patients are interested in cannabis, I want to educate them before we ever go down that route. And a lot of my patients, by the time they get to me, they say, listen, I tried to talk to my doctor. My doctor was like, absolutely not. And I say, how did you talk to your doctor? Let's evaluate that. Did you walk in and say, hey, doc, I'm having some anxiety, so I hit the bong and, now I'm fine. Let's talk about terminology. Let's talk about how we speak about the plant. And number one is like the one big stigma that is like, oh, in my brain is that it is cannabis. Like that's the scientific name. So if you want to have a progressive conversation with your doctor, use the medical terminology cannabis, take marijuana, Mary Jane, pot, all of those things out of it and treat it like the medicine that it is.
Yeah.
So, hey doctor, I had my microdose with my edible at 2.5 milligrams in the morning to try to help combat my anxiety throughout the day. And then 6 hours later, I did another 2.5. And I've had amazing results with patients that come back and say, hey, my doctor actually respected what the hell I said.
Yes.
So it makes a huge difference how you talk about the medicine too. So
Yeah, absolutely. And that's a really good point. Kind of meeting their level where they're
yeah,
at, right?
yeah,
Like using that word because if we look at right, because there's hemp as well. So do you want
right,
to just go
exactly.
like break down that? Because I think a lot of people when they think about marijuana or cannabis,
Yep,
it's like
yep,
they think of getting high. And it's like
yeah,
that's not
absolutely.
what it dude,
That
there's
is
so
not what it
many wonderful
is.
parts of this plant. Can you dive into that a little bit?
Yeah, absolutely. So the big thing, it's funny, we've had all of these different things happen with Trump in office. He signed a couple of different, different stuff, but the difference between like hemp and cannabis is literally 0.3% tested out on the lab. So the lab, your medicine, sorry, I use my hands a lot. Your medicine should always come with a certificate of analysis that shows you for your safety where your medicine came from, how it was grown, if there's any microbials, if there's any pesticides, what terpene profile, all of those things are in the medicine when you buy it from a dispensary. Okay. So if it grows out, whenever they test the plant, if it grows out 0.3% or less, then that's hemp. All right. That's legal.
Mhm.
If it's 0.3% or greater, then that's cannabis. That's illegal. That THC. Excuse me. Let me rephrase that. THC. Okay. The other cannabinoids, they can be whatever, but it's the THC that's illegal. If it's greater than 3%, illegal. Less than 3%, hemp, legal.
Yeah.
Does that
Yeah.
kind of clear up
Yeah.
just a hair? So
Yeah.
yeah, so you have all of those markets where the hemp, you can buy those, those there's great manufacturers out there of the plant. There's so many, I have a lot of people say, why don't you, come up with your own brand and do your own. There's so much medicine out there. I do not need to reinvent the wheel. There's so many fantastic products. Okay.
Yeah.
My baby is education. People need
Yeah.
to be educated about it. So
Yeah.
where I'm at with
Yeah.
it.
I love that. I love that. Yeah. And I think what you said before is like breaking the stigma,
Yeah.
and breaking the stigma across or this mental health situation or nervous system dysregulation that we are all currently experiencing. For a lot of nurses are very much disconnected from the body.
Oh my gosh,
Like
yes.
like 99.9% are,
Yeah, yeah,
unless you've, gotten with the plant medicine and you're starting to do a little bit of work and we said every day is a healing journey itself.
yeah,
But
so
what
true.
what have you noticed with the people that you work with? What are some of the positive effects that you've seen within clients that you coach?
That's the kind of thing that makes me tear up because if you have spent any amount of time behind hospital wall, you have seen sorrow, you have seen loss of hope, you have seen pain like no pain that you see not in a hospital setting. And when you have a little like 80-year-old lady that says, I can't even move my hands because of arthritis. And you show her how to use just a little salve on her hands, and she can open her hands. She can hold her husband's hand for the first time in forever without it hurting. Like, okay, I'm totally going to cure up. But like,
Oh,
it's that kind of stuff. Literally, I get text and emails and social media posts all the time. That's just, thank you. I slept for the first time in 8 hours in, months, years.
wow.
I was able to like get up from bed and walk to my couch or walk to the bathroom without excruciating pain with every step or with every, my back's not hurting. And when you hear those stories, like it moves you forward. After you've seen so much suffering, it will move you forward with this medicine. So, and just even my own healing journey, learning to love myself again, learning to trust myself again, learning to like fall back in love with nursing again. How many of us are like, fuck this, I'm done with this. I've given all I can got, right? I mean, I've given all I can give, but that medicine literally will help you calm the chaos. That's my big thing. Calm the chaos. There's not all the chatter anymore. It
Yeah.
really calms. And I remember I was working with a mother and her daughter, a 15-year-old daughter, and her daughter, you could just see it on her face, completely numb on all the antipsychotics, antidepressants, just numb. And I was educating the mom and the daughter, and mom was asking me some specific questions. And I distinctly remember when I said, cannabis, one thing I can give it credit for is it will help you learn to love yourself again and see light again.
Mm.
And that daughter literally lit up and turned around and looked at me and she said, "What did you say?" And paid attention to me. And her mom started crying. And her mom's like, "I've never seen her have that kind." It's so fucking true. Excuse my language, but
Yeah.
it's so true when you see that patient light up with a medicine that literally came from the soil that you're standing on.
Yeah.
You will go to bats for it. You will go to bats for it every time. So
Yeah.
the,
Yeah.
it's, yeah,
Yeah.
it's
Yeah.
very, very,
So powerful. I
it's
mean,
very, very powerful.
especially like the teen population right
Yeah.
now,
Yeah.
it's one diagnosis after another. I think it's like 1 in 3 teens are diagnosed with some sort of
Yeah.
mental health disorder.
Absolutely, yeah. And they're
It's
in kind of just that little disarray anyway about their bodies and learning to love themselves and that whole I mean there's the social media and I got to be this way and that way and I feel like what's really important with cannabis use is intentional use.
yes.
We're not reactive with our medicine. We're not taking this medicine, but now we're going to learn to microdose, small doses throughout the day. I have noticed has been the most effective,
Yeah.
so that we don't get to that point.
Yeah.
Like we're already setting ourselves up for success before we even get to that high anxiety where now we're trying to combat and come down from that. But, the medicine really helps you learn about yourself, which I think is the most important thing. We get so disconnected from, let me just make a doctor's appointment, go get a pill for this.
Yeah.
Right. But hey, you know what? I really want you to understand how your body works and listen to your body because it's going to tell you everything you need to know. And,
Yeah.
and, and you actually have a system in your body that was made to help you heal and help provide that balance. So it's so empowering. And people don't know about the endocannabinoid system. They don't know that we have this system. If we treat
No.
it right, if we nurture it, that's crazy. So I
Yeah.
love it.
It's amazing. It's amazing. Yeah. And just even this brief amount of time we get to spend together, just sharing this knowledge, I know that somebody out there will be like, maybe I should try this.
Yeah.
Maybe now that I understand a little bit that I'm not just taking the THC and that there's all
Right.
these other
Yes.
essentials, right, of the plant that I can take. It's
Right.
this is where it starts. This is where it starts, nurses. And you still work in the hospital, right? You said trauma one.
I work at a level one trauma center. I'm in a pre-surgical area. So
Okay.
I am fully supported by my management. They know what I do. I literally have nurses come find me in the hospital to ask me questions.
Yeah.
And again, it's just getting over that hump of having a voice
Yeah.
and not being afraid to say, I understand this medicine and I can answer your questions. And if I don't, I'll find out. But I am literally, kind of known for, hey, go ask Sammie the questions and go ask Sammie about how to talk to this patient about this. And it's pretty cool.
That
It's not
is
so bad.
so cool. That is so cool. And I hope that every hospital has you eventually in there because there's so many patients that need that in that moment. I mean, I can see how this could be so great and effective for pre-op situation
Yes,
when you're high anxiety and stress, and instead of giving Xanax, let's do
yes.
a drop or whatever the dosage is, right?
You know what the craziest thing too is even like I do pre-op patients. I get them ready for surgery. So I look over their pre-op stuff, and of course that's always the substance abuse. I wish we could take it out of that, but it's what's your substance abuse? And the anesthesia instructions will be stop your marijuana 48 hours before your surgery. So I already know in my head that patient I'm going in to see is a cannabis user. And I'll walk in and just make some general comment about it. Or I'm not even kidding you now. I have zero problems telling every single patient that this is what I do on
Yeah.
my other time. But
Yeah.
when you make that connection with them and they don't feel judged for their cannabis use, I can't tell you the light that comes on, the anxiety decreases. They know that they're supported. They know that it's okay after the anesthesia's wore off to restart their medicine again. And just having that conversation, it literally eases anxiety. We should be having these conversations with our patients.
Yeah.
Educated conversations. I'm not saying that you're saying I support your cannabis use, but you know what? I'm going to educate myself so that when it comes up, I can talk to you in a professional way instead of a judgmental, oh, you're slinging joints and smoking bongs,
Yeah.
so
Yeah.
anyway.
Yeah. Hitting the Doritos too hard, you know what I mean?
Yeah.
That's a funny story, actually. I've had experience with that because at one point in time, I didn't want to be in this realm, and I was like, oh my God, I'm just gonna smoke until I can't smoke anymore. And literally, that is not a good route to take because you won't die. You'll just get so high
Exactly.
that you
Right.
fall asleep, or you'll just be like Doritos will be all over you,
All over
in your
you.
hair from experience.
I know about that, girl. I know about that.
Or something like just sitting in your lap. You're like, what the fuck? So
Pretty
it's
fucking
it's so funny that that it's been stigmatized because it's such a powerful medicine. And I want to go back to the intention piece because it's very different than, say, I have high blood pressure and I'm going to go ahead and take my blood pressure medication. I'm not going to be like, okay, medicine, because this is like intentional.
uh-huh.
Okay, okay, blood pressure medication that my doctor gave me. Go ahead and open up all the vessels in my body so my blood pressure can lower. Like
We don't think about
that's
that at all.
it's not
Right.
that's not what we're talking about with like affirmations and intention. It's the intention of a self-awareness
Yes, self-awareness.
that this medicine can bring you to new levels and light, like you were talking.
Yes, light is the whole thing. I like you nailed it right there. Like cannabis is it is literally love and light when you use it intentionally. It's not saying I'm not going to have any fucking nightmares tonight. It's saying when they enter, when they come in, I'm able to set it aside and go back to sleep. And know that I don't have to sit in that all night, that I am able to go back to sleep. When I take CBN, if you're not using CBN for night, if you're someone that doesn't sleep well, the cannabinoid CBN, just think in for nighttime. I'm telling you, you'll have the best sleep ever and you'll wake up without a hangover. And it doesn't have THC. It's a great cannabinoid. So that's just another example. But setting intentions is so huge. Oh, it's so huge. So, and that's just a part of cannabis use. Just like you said, you don't take your blood pressure medicine to be like, I'm gonna have, no,
Like,
it's very an intentional. Yeah,
yeah.
it's a very okay. And so you had made a point a second ago about the munchies. It's funny that you had mentioned that because I am very overweight. I grew up in an era of not even 30-minute lunch breaks as fast as I can eat. I'm very overweight. I've since lost 60 pounds because I am intentionally setting myself up when I use cannabis, when I do get the munchies, because you will get the munchies, because that CB1 receptor in the salivary glands and all of the things, which we didn't talk about, but um, to set myself up to feed nutritious food and be very intentionally and aware of what I put into my mouth. And I'm down 60 pounds because of it, because I'm no longer just like eating out of, I'm eating intentionally and being very aware of what I put into my body. It's been the craziest journey and blah,
Yeah.
blah, blah. But
Yeah.
again, that endocannabinoid system is literally made to help us find balance and work with us. So,
Yeah, I love that. I love that you said that because on the opposite side, I use it to eat because I have Ehlers-Danlos
yeah,
syndrome.
yeah,
And sometimes, especially like in the morning, I'll get really nauseous or I have a hard time eating sometimes. So
yeah,
I'll take a couple drops
yeah.
and I will be like, okay, I'm gonna grab a salad or grab something to eat, right? And my mind goes more towards like eating healthy rather than
Yeah,
like I love a good Chick-fil-A sandwich, but that shit
yeah.
fucks me up, like but the
It's
wrap,
intentional.
like,
Yes. Yeah. Being
plants.
aware, self-aware. You had said earlier, it literally will make you self-aware of everything. So, yeah.
Yeah,
And
be
I
ready for
wanted
that.
to kind of touch really quick on back to the endocannabinoid system. You have all of these little CB1 and CB2 receptors that are all over your body, right? They were founded in the body, and these are what kind of keep us all in balance, and they're found everywhere all over the body. But there is not a CB1 receptor, and this is what cannabis attaches to and goes to wherever you need help. But there's not a CB1 receptor found in the medulla oblongata that controls your respiratory rate and heart rate. So no matter how much cannabis you use, it's never going to stop you from breathing. So
Yeah,
there's no documented overdoses. Now there are tons of side effects. We all know that we have felt like we're going to die sometime.
yeah, yeah,
But and I would love to work with ER nurses about how we can kind of combat that. And I joke with some of my colleagues about cancel the ambulance. You don't need the damn ambulance. Just text me. I'll keep you in check. You're gonna come down off of that cannabis. So for people
Yeah,
need to know
it's
an overdose. Yeah.
yeah, that's so funny you said that because working in the ED as well, I've seen many people come in like just high as shit and
Yeah.
they're just like, what do I do? And they give them all the things and it's like so what I've had patients do, there's been some that have actually combated it with CBD.
Yeah,
Have
CBD.
you
Yep.
seen that?
Yes,
Or have you,
absolutely.
okay.
Absolutely. When I'm working with patients too, I always want them when they're starting with THC or they're wanting to kind of go down that route. We're finding out the cannabinoids. I really always want them to have CBD on hand and peppercorns. Those are kind of the two things that I like hope that they have on hand because those two things will literally pull that THC out of those CB1 and CB2 receptors to kind of bring them down from being so high. So yeah, anytime that if you eat like, I don't know, 10 milligram edible gummy, THC edible, and it's too much, and you're like, holy shit, this is too much. If you just match that with the CBD, and like I said, this is all educational. I'm not trying to give medical advice, but if you match that CBD, it will take effect and pull that THC out of those CB1 and CB2 receptors that's making you feel way too fucked up. And it doesn't take very long. Cold showers are good. Put on I laugh. Don't go watch no like, what's some
Like Pulp
terrible
Fiction or like
movie.
Requiem for a Dream.
Right. Like put
Those are
some good
fucking
music on, set the mood, and
yeah.
just know that you're in a safe spot and everything's going to be okay. So those side effects, they can be a little rotten though. We know about those, right? We all have those stories.
Yes. Oh my gosh. Yeah. And I think it's so important because, at the amount of people that go to the emergency room because of too high of a high,
Yeah.
if they knew this information, wherever they got that THC from, if that bud tender or that person at the dispensary was like, hey, actually, I'm going to advise you, you probably want to take a CBD with you home as well, just in case. So where are you at in the process of like educating dispensaries? Because I know that's like lacking totally right now.
I do have a little program that I do. It's really all about that fundamental, those fundamental classes, the fundamental education. So I do reach out to dispensaries if anybody wants some education. I've done some dispensary education in Missouri, down in Arkansas, reaching out to Oklahoma now, virtually online. So definitely getting the word out there. We're spreading it. We're getting there. So just finding and brands. I've worked with some brands on their education. So and it's really just matching that the medicine's out there but what are you seeing in the dispensary? What are patients coming in asking you for? And 99% of the time they tell me patients are coming in asking for something for pain, something for anxiety, something for sleep. So it's just getting that so that they feel comfortable addressing those things.
Right.
Like one example is I was talking to a patient same day surgery and she's like, oh, I had a fucking terrible experience. I ended up in the ER. And I'm like, well, tell me about it. She went in for something for anxiety and the bud tender told her to take 100 milligram edible. Okay. Nowhere in any would I never, ever recommend somebody out the gate taking
Dude,
100
dude
milligrams.
was dude was high himself.
Yes, right, exactly. So she ended up having to call her husband, come off the golf course, take her to the ER. It was a terrible
Yeah.
experience. So I just wanted her to know that not every experience is like
Yeah.
that. And just because you had that one experience doesn't mean you're ever going to have that experience again. So don't give up on the medicine. Usually, if there's anything I've learned kind of in this process, is that I feel like anxiety when you take this medicine for anxiety, this medicine is going to show you what you need to know
Mhm.
to help with your anxiety. That's what the medicine does. It is not a side effect of the medicine. It is your body responding to the medicine to show you how we're going to treat this anxiety and what we need to do about it. So it's really it's the medicine showing you and working with you. If there's anything that I've learned, it's that I've seen it firsthand. I'm sure you have too. And I've seen it firsthand working with patients that they take this high dose and then they call me and they're freaking out. Well, 6 hours ago, I just seen you know that's the medicine showing you what you need to know.
Yes. Yeah,
So
yeah.
yeah,
That's so important. You say that because in a traditional setting, doctor prescribes the Xanax, right? You're trying to hit the anxiety, but the plant is actually going to tell you the truth of
yes,
why you're having the anxiety. It's the truth teller. So
the
instead
truth
of
teller.
covering it up and like
Exactly.
more into your body because that shit's gonna come out later. It will.
Yeah,
Have
exactly.
experience with that. It's
Yep.
the plant's going to show you. So you also have to be ready for that. So that's
Yeah.
why the integration of maybe seeing somebody that specializes in that, like a type of like a somatic therapy or
Oh,
some sort of CBT or DBT, right? Like, because
yeah.
shit's going to come out and you're going to be like, sometimes people want to step back and stop because it's too
Yeah.
much, right?
Yeah.
So let's
Absolutely.
go back to that. Like people that have, and I have friends that have taken a gummy and they were with their friends and they got really fucked up and they're like, never again.
Yeah. Never again. I'm never
What
doing
can
that
you
shit
tell those
again.
people here today? Like,
Start
don't,
low and go slow.
yeah,
Just start
yeah,
low. Start way low. I always like for patients to do, there's one of the most empowering things I think about this medicine is that you have options for routes of administration,
yes,
right? You get to choose how you want to use your cannabis. So I feel like that's just so empowering when it comes to the plant. So start low, choose an edible that's, just start out with like 2.5, cut it up. Just
mhm,
start low and listen to your body and see if it's helping. That way we have room to grow should we need it, which we always have room to grow and need it, but maybe you need a little bit more at this time of the day or during the holidays, everybody kind of increases their ramps up their dosing, but start as low as you can possibly start and listen to your body and how it reacts. So just because you had a bad experience, that a lot of people don't understand too is that the cultivators, they're the ones making the medicine. So they've got that down to a fine art. What you took back then is not necessarily what you're going to take again,
yeah,
ever, right?
mhm,
So just
yeah,
start low, go slow, take it easy, be easy on you, be easy on you.
yes. Yeah, because like all of this didn't just happen overnight. Like
Right,
you've collected all of your trauma and all your wonderful humanness of experiences that we have on this lovely life journey. And
yeah,
it's not gonna like just cure you overnight. Like, and
right,
it's not a blood pressure medication that's going to drop you like right then and there. It's integrated with your body. You have to work with your body. It's a co-relationship with a
yeah,
literal plant that comes from our earth that was put here to help us, but has been demonized because of big pharma. Like we're not
yeah.
playing anymore.
We're
Like that's what happened.
intimidated by it.
Yeah. Yeah.
Yeah,
Yeah. It's
it is
crazy.
crazy. Yeah.
So I want to end the stigma with like getting this information more out to nurses because nurses, one, are afraid to even talk about cannabis. Number
1000%.
two, they're like, oh my God, the drug test. Number three, they're like, oh my God, what are my friends and family going to think of me? And then number four, they're just like so not informed, they don't know
Yeah.
where to go. So, what would be like a starting point for a nurse that is interested in this?
So there's a lot of professional organizations out there. There's the American Cannabis Nurse Association, the Cannabis Nurse Clinicians, or the Cannabis Nurse Network. They're huge. They're amazing. Society of Cannabis Clinicians. So there's lots of professional organizations. There are lots of online virtual programs. I threw a virtual program up on my website that's simple, easy, virtual work at your own pace just to kind of get your feet wet. Then there's like university programs where you can really dive into learning as much as you can. Like really the sky's the limit. If there's anything I want you to know, it's start educating yourself because this is not going anywhere. And you're only going to be one more step ahead of the game if you start educating yourself now. So there's lots of professional organizations. There's lots of conferences. You guys, Modern Nurse Fest, you guys are integrating some of this stuff into your conference. I just came back from SUNY Niagara. I went up to New York and did a cannabis conference up there. There's CanMeds coming up at Lake Tahoe. So there's lots of ways that you can learn this information. And one stigma I want you to really understand that really made a difference with me is when I had another nurse tell me, you are educating on a medication. You are not saying just because you're learning about this medicine, you're not saying I'm a cannabis user. You're educating yourself so that you can be better for your patients. Whatever you want to do with that's up to you. I have since found my voice and been true to my story, but that didn't come out the gate. And another thing that I learned, I just want to throw out really quick, is that my PTSD did not, what I have learned is that my PTSD did not start with COVID. I have been a critical care nurse for 20 plus years. I have got trauma to fucking work through, okay? They don't teach you about nursing trauma, but it is a real deal. We see this shit, okay? So there are things that have come up and I have learned to use and integrate. through all of this education, through the different platforms, through the different, you'll find where you fit in. Not every organization is where you need to be, but you've got to start somewhere. So all of these different organizations, the different nurses, I feel like all of us cannabis nurses, we really know each other, and we are like literally a cult all over the country. We know each other. So we
Yeah.
are here to spread the word and share the love. So
Yeah, yeah. And there's so many. There's so many. So,
some,
nurses, don't be afraid. Don't be
yeah,
this is a
don't
plant.
be afraid.
Like
Yes.
you can go in nature and be like, "Oh, there it is right there." Like it's not
Yeah.
on a shelf in a pharmacy. There's no dude that's composing like what's going to go into this drug. And in fact, what's so lovely is when I go to dispensary, like all of the stuff that's in that bottle is listed out.
Yes.
Unlike big pharma, like they're just going to be like, "Take this pill."
Yeah. Here it
Like, yeah,
is.
okay, I will. And you don't
And
even know what's in there.
you can do like dispensary tours. You can do grow facility tours where you can actually see how your medicine is made that's going into your body.
I
So
love
nobody's trying to
tours.
hide it from you. That's the great thing. It's
Yeah.
not where nobody's trying to hide this medicine. In fact, cultivators more than anything want to show you how it's grown. So that's anything, that's what I've learned. But
Yeah.
so it's
Yeah.
yeah, it's a great community.
Yeah. Yeah. And yeah, if you're in a state where it's legal and there's dispensaries, like go in and be like, hey, I'm a nurse. I just want to learn so I can educate my patients. And they're going to be like, come on.
Yes, there's never been a time where I've been in a dispensary where they're like, "No, get the fuck out."
Yeah.
They are like very excited and they want that help and they want, you want to know just as much as they want to know. So now's the time, nurses. Now's the
It's the
time.
time. Get on it or get out. Like this is modern nursing. This is modern healthcare. And this is the way that this is the way it's going. If
Thank you so
84%.
much for giving us a platform to even talk about this. I mean, I understand that it is a stigma that you yourself have to get over. Me
Yeah.
myself had to get over.
Yeah.
And I feel like once you get over that hump, you're not scared of your story. You're not scared of saying, "Hey, I'm taking my health first.
Yeah.
I'm not going to have somebody scare me with a drug test
Yeah.
for me to not choose a medicine that's right for me."
Yeah.
So, and I realize there are these, we're talking to nurses that are in states that aren't even legal at all.
Yeah.
And I know that that's hard, but it's coming. It is
Yeah.
coming. So
It's
just hang in there. Yeah.
Just hang in there, make sure you're educated. You can learn from amazing. There's tons of cannabis nurses, and we have several coming to every single Modern Nurse Fest, and ones that even make products. Like so, it's amazing the nurses that are there. So yeah, absolutely. So even, if you're a nurse and you are going into a stressful situation, you can take cannabis before you go into that stressful situation. Don't think you can't. I
I
used to
think,
do it before I taught at Emory University. I would
yeah.
in my
Yeah.
car and then I would go in and teach. I wasn't high, but
Yes.
I was very grounded and
But
less
we're grounded. Yeah.
right?
Yep.
Like
Yep.
I came in a more grounded place and
Yeah.
in a more of a response instead of a
Yep.
reactive place.
Yes, exactly. Yep.
So,
Absolutely.
it's not just good for nurses, it's good for our all of our healthcare professionals, including our law enforcement. Like
Yes.
if anybody needs it at this moment, like those
Right.
guys.
EMS, like EMS firefighters, anybody with that kind of trauma. Oh man.
Yeah.
Yeah, for sure.
Yeah, absolutely. Yeah. Well, right on. Thank you for being here. Where can we find you? Where can people reach out if they
You
want to
can
learn?
find me on all over social media. I'm known as Cannabis Nurse Sammie on Instagram, LinkedIn. I'm now on TikTok. I finally joined the TikTok bandwagon. I'm making all kinds of videos, but a Cannabis Nurse Sammie across the board. My website is Nursing Nature's Way. That's my business, nursingnature'sway.podia.com. I, have all kinds of stuff on there. Like I said, I've done that. I've created that little just educational, get your feet wet. I've done a lot of silly videos so you can see me being all goofy and then just giving you all the information. So you can find me everywhere. Reach out to me. If you're listening and you have resonated with this at all, reach out to me. Seriously, I will answer all the messages. I love to talk. You are my people. I am here for you. So I'm telling you, this medicine has literally made me fall back in love with nursing and being a nurse again. So don't hesitate to reach out to me at all.
Oh,
Here.
awesome.
So,
Yay.
yeah.
Well, thank you, Nurse Sammy. It was such an honor to have you on here and just spread
You.
and share love and light. And I can't wait to have you at a Modern Nurse Fest.
Yes, girl. I'm counting on it. I'm going to be at one.
Yes, let's
Thank
make it
you so
happen.
much.
Make it happen. And yeah, make sure you reach out to Nurse Sammy. She's here. This is this is what she's passionate about. And you can
Yeah,
tell, because she's lived the experience. And that's the people that we really need to learn from and go to when we need help, is people that have actually done the work and lived the experience, because that is human experience research right there. We don't need
absolutely.
science sometimes. We just need humans telling other
Yeah,
humans their experience and what
yeah,
happened,
absolutely. That's that
So
connection. Cannabis is all about connection, and that's that connection. So, yep.
yes, in so many ways, in so many
Yeah,
ways. Yeah.
yeah.
Well, thank you for being here. And again, reach out to her and we'll see you guys. We'll see you guys around. Thanks for being here. Bye.
Okay. Bye.